Hi, okay, so today we're going to talk about vitamin D and your immune system because it's been in the news and I wanted to provide some clarity. So, most recently, there was a research study that said that patients in hospital with COVID-19 tested low on vitamin D. So, what's the connection and why should we be concerned about this? Well, vitamin D actually does more than just make us feel good in the wintertime. We know it as the sunshine vitamin. If our levels of vitamin D are low in the northern hemisphere, we can affect our mood, we can feel sad, seasonal affective disorder. Also, vitamin D is connected to making sure that you have good, healthy calcium metabolism, so bone density. Okay, so what does it do for your immune system? Well, vitamin D actually has a job of signaling your immune system into action. Vitamin D helps with modulating or balancing your immune response. So it's in fact helpful for autoimmune conditions where your immune system is out of whack and it's overreacting. And vitamin D can also help with modulating your inflammation response and specifically your cytokine production. And we've heard that a lot in the news, the cytokine storm, like when people get very, very sick with this virus and in some cases are really struggling with recovery. They have this huge inflammation response and they're calling it the cytokine storm. How do we calm that down? Well, one of the ways that we can calm that down is to make sure that we have good, healthy vitamin D levels in our system. So vitamin D is actually really easy to come by, but I'm going to kind of give you some advice as to what forms of vitamin D to use. Dosing, that's entirely up to you and your healthcare practitioner, all right? The recommendation in Canada is 1,000 international units. That's how it's measured here, and across the world really is in international units. But your healthcare provider may want to test to see what your blood levels are like, and you may need to take more than that. Now, vitamin D, if you do need to take elevated levels of vitamin D, you should really combine it with vitamin K2. All right, so vitamin K2 and vitamin D, they kind of work in concert. So what a vitamin D does, vitamin D actually helps to pick up calcium from your gut, pushes it through your intestinal wall and carries it into your bloodstream. Then what vitamin K2 does is it picks the calcium up from your blood and it pushes it into your bone, so it calcifies your bone. And it basically travels around your blood and goes and looks for free calcium in your kidneys, wherever it's sitting, and it pushes it into your bone. So it actually helps with preventing calcification on the lining of your blood vessels or for calcium building up in your kidneys and getting kidney stones. Like vitamin K2 is really important. Now, when you take elevated levels of vitamin D, it can actually negatively impact your vitamin K2 levels, because what may happen is you may have really high levels of calcium in your blood because you've got all this vitamin D in your system, and then you don't have enough vitamin K2 to pick up all that calcium and push it into your bone. So if you are advised to take higher levels of vitamin D, then you should be combining it with K2 to make sure that you have a proper balance so you can prevent calcification in the wrong places. We only want the calcium in the bones, okay? Okay, so there are a number of different types of vitamin D supplements on the market. The canprev company does a vitamin D3 and K2 combo. You can get them in capsules, soft gel capsules, and the content inside the capsule is in a liquid form. You can also get them in drops, all right? And the dose recommendation is 1 capsule, which will give you 1,000 international units of vitamin D, and then 120 micrograms of vitamin K2. That's the standard recommendation. In the drops, it's 4 drops to reach that dose. Now, if you have issues with emulsifying fat, so in other words, if you don't have a gallbladder, or if you have gallbladder issues and you're not producing enough bile, because bile is the stuff that emulsifies things, remember that vitamin D3 is an emulsified, it needs to be emulsified, so it's a fat soluble vitamin. So there are actually products available on the market that have been emulsified for you, so in other words, broken down for you, especially if you have issues in that area. The Genestra company, which is it's a Canadian professional manufacturer, has an emulsified form of vitamin D3 in drops. Nice and easy. 1 drop is 1,000 international units, so you just take as many drops as your physician recommends. Okay, And an emulsified form of vitamin D can also be taken on an empty stomach, so you don't have to necessarily eat with it. And one other tip, if you're taking an omega-3 or an essential fatty acid supplement, try and take it around the same time as your D3 supplement. They like each other, they work together much better. Okay, so take your vitamin D consistently. Ask your doctor what type of dose you should be taking. Ask your naturopath to test you. You may need to take more than 1,000 international units, and take it consistently because you're modulating your immune system, so you have a good healthy immune response, and you're modulating your inflammation so that you're not overproducing inflammation, so if you do get sick, that you're going to have a really quick recovery. All right, thank you so much for listening. This was a short one. I hope you found this helpful. Please continue clicking in, so don't forget to click the like button, click subscribe, and don't forget to hit the notification bell so that you'll know when I post new videos. Have a fabulous day and keep well. Bye-bye.